Friends, if you've ever been curious about what really makes a biological dentist a legit biological dentist, then this is the episode for you, because it has become a crazy trend to call yourself a biological dentist, take a weekend class, and start attracting patients in. But you need to know some things. And today we're going to tell you exactly what you need to know and the questions you should be asking to determine if biological dentist you're seeing is legit. Welcome everyone to another episode of Your Mouth Matters. And I got the world famous and incredible Dr. Rebecca Taylor in the house.
Oh, wow, Barry, that was a great intro.
Yeah.
World famous. I don't know about that. We'll see how far we can push this podcast.
Exactly. Famous, it's coming, it's building. It's absolutely building. Today's topic is a great one because people find us a lot of times after they've gone to a variety of other biological dentists that turns out aren't really that comprehensive or deep or holistic, or really maybe we wouldn't even actually consider them legit biological dentists. So let's get into this topic because it's something that we want to educate people on.
Yeah. So just to lay the foundation. So there is no dental school, like there's no specialty program after dental school or any program, any dental school program that teaches biological dentistry. So it's really unregulated. There are classes and certification courses that you can do, but anybody can put on their website that they practice holistic or biological dentistry. Okay, it's not like if you're an orthodontist, you have to go through ortho specialty training after dental school, and then you graduate and you are officially an orthodontist. That's your specialty. Holistic dentistry and biological dentistry are not like that. So what that means is that you really have no idea when you go to a dentist who claims that they're a biological dentist or a holistic dentist. You have really no idea if you are going to somebody who has taken a weekend course in something like safe mercury removal or been to maybe one IOMT conference, or if you're going to somebody who has gone through a ton of more extensive training into the rabbit hole of biological dentistry and oral systemic connection. So I know that a lot of our patients will go and they're searching and trying to find a dentist. And I hear almost every day, man, I wish I would have found you guys first because like you guys are so comprehensive and this is actually a true comprehensive biological dental office at Green City Dental. And I know that a lot of you are maybe not local to us. There's some of our listeners that are like they're in Texas or you're just not close to us. And so how do you screen dental offices that claim that they're biological to know if you found a good one or not? And so that's what I want to dive into today. And hopefully that'll shed some light on what, if you want to go and spend your time and money at a dental office and at least give you kind of a step in, give you some insight before you decide to go.
Yeah, I love it. I think it's great, super helpful, super beneficial. And whether, again, you're local or you're listening to us abroad, we're going to go through the kinds of questions that you should be asking and basically an internal checklist, things you should be looking for that tell you you're in the right place.
Yes. So first of all, when you call the office to make an appointment or just to interview, I would say that when you call, you should be thinking of it as more of you're interviewing this dental office and you should ask them certain questions and you're looking for certain answers, okay? And if they answer everything correctly, then you probably found a pretty good office. So first of all, a biological dental office, we really care about comprehensive care and everybody is an individual, okay? So nothing is really one size fits all. And so with that means that we're doing proper diagnostics. So if you call a dental office and say, hey, I'm a new patient, like what kind of imaging or what kind of testing are you guys going to be doing? You really want them to say, we require a CT scan on every patient. CT scans, we've talked about before, are so important. Infections with CT scans that you cannot see with regular X-rays. So a truly comprehensive biological dentist is going to be taking a CT scan of top and bottom teeth, and that should include the airway as well. Okay, so that's the first question is, do you take CT scans on every new patient? The other question that you could ask is, do you have a microscope that you use to look at plaque and evaluate the oral microbiome. Our hygienist here will take a plaque sample, put it under the microscope, and we can see if you have high-risk bacteria. We can see if there's white blood cells, which would maybe indicate that there may be some type of gum infection. We also can see if that doesn't change with our intervention, that maybe there's something systemically going on. I've actually helped people figure out that they have like lymphoma, for example. I had a patient who had unexplained microscope slide and was doing all the right things, but still had this infection going on. And so if you're able to see that and identify that, you can help guide that patient to the right place so that they can get proper diagnostics. So do you use a microscope? We really focus a lot on the microbiome in the mouth. And so how do we check that? Right. And so maybe that office uses a microscope. If they don't have a microscope, maybe they offer salivary diagnostics where you swish with some saline, you spit it out, they send it to a lab. But you want your dental office to be able to do a test on the oral microbiome. Okay. And this includes periodontal pathogens. It also can include cavity bacteria. Those are kind of the two main ones. And then any of those other really high risk bacteria that are linked to other systemic issues like Alzheimer's and cardiovascular disease. The other thing that you want to ask your dental office when you're calling them, especially if you are a sensitive patient, is do you offer biocompatibility testing? The biocompatibility testing is where it's actually a blood draw. And so you will go to the lab, they'll draw your blood, and they will send it to a lab. There are two companies that do biocompatibility testing. And so if they say, yes, we do, you want to ask them who it is. The two labs that we work with are Clifford Lab and Biocomp. Those are the only two that I know of that are on the market and available to dentists in the United States. So biocompatibility testing, blood test, you would then get a report back with over 700 dental materials that would tell you if your body is going to have an immune reaction to a material. So what that does is allows the dentist then to pick the right materials for your body. And in our office, I pick mostly biocompatible materials. I've done enough of those tests to see which ones work usually, which ones don't. We usually are using the materials that are going to be okay for, I would say, 95% of people. So I don't require biocompatibility testing on everybody, but we do have it as an option for people that are really sensitive, and a biological dental office, they better be offering that. Okay. Then the next question, especially if you have mercury fillings, is going to be, what's your office's position on mercury? Are you a mercury-free office? Or are you a mercury-safe office? This really, I think people get confused about, because a lot of dentists will claim that they are mercury-free. But being mercury-free only means that you don't place mercury fillings. Okay, and remember, the exposure for mercury fillings happens when you remove them. So a mercury-safe dentist is going to have a protocol to protect you from exposure of removing your filling. They're going to have gone through extra classes and accreditation programs to that will make sure that they're removing your mercury fillings safely so that you're not getting exposed and so that they're not getting exposed. This includes different air filtration systems, different mouth rinses that are used to bind the metals. There's protocols that we use before we remove mercury and then after we remove mercury. And then we are always talking to patients about going and getting more heavy metal testing done with their naturopaths and maybe doing some detox and chelation afterwards. The dental office that you call should be able to talk to you about their protocol when removing mercury fillings, and they should feel really comfortable with that. If they say, oh yeah, we're just a mercury-free office, and they don't really talk about any of that other stuff, they're probably not going to be doing that really comprehensive mercury-safe protocol. Okay. And there's a couple of different trainings that are out there. The IAOMT has standardized what safe mercury removal looks like. And I went through their accreditation program. It took me a year and a half to go through their whole program. I had to take exams, tests. I had to submit cases. It was like going back to dental school again. They are not going to let people become accredited unless you're doing it right. Okay, so you want to make sure that the provider that you're seeing in the office has been accredited by the IAOMT Or is the IMT also their new accreditation program, which I have not been through because I already did their old one, but they've now rebranded it as the SAFE. So SAFE. So if they do safe mercury removal, that's a dentist that's been through that program. So you want to definitely ask that. And when you go in to have your mercury removed, you want to see that they're putting oxygen on you. You want to have an outside air source. You want to see all of those other precautions. Okay. You want to make sure that they're using a rubber dam and suction, and you want to make sure that the dentist is wearing their big mask. That is all sign that they're doing it right. Okay. The other one that we get asked a lot is so another thing that you can ask the office when you call is, what's your position about root canals? Root canals are a real hot topic. We have a whole other podcast about root canals that I encourage you to listen to if you are interested. Root canals are not a very biological dental thing to do. In our office, we always want to talk to patients about their options. I have seen patients that have had root canals removed when their health actually improved and systemically they got better. And of course, we can never say that that is true for everybody because then we'd be practicing medicine. But if you call a dental office and you're like, hey, if my tooth is infected, what are my options? And they're like, root canal. And we would do it in our office. I would be a little skeptical about that. If they say the answer you want to hear is, if you have an infection, there's kind of two options. You could do a root canal. You could also do an extraction. You always want to make sure that they say that an extraction is an option for you. If they don't, if they say you just need a root canal, that's probably a sign that they're not really that biological. And if they are doing root canals and you want to have a root canal done, there are more biological ways of doing a root canal. You can do root canals with using ozone and laser. You can do root canals with bioceramic materials that are less toxic than the traditional materials that are used. So if they are doing root canals in their office, you want to ask them, how is your root canal different? How is your root canal biological? There's an endodontist in LA, Dr. Val Cantor, who teaches a more biological type of root canal. And so you just want to make sure that office is trained. Personally, I don't think I would ever see a general dentist for a root canal because it's such a precise procedure. Root canals are one of those things I do zero of in my office because I really think that extra 2 or 3 years of training that an endodontist goes through is so valuable. So I would be a little skeptical if the office is doing root canals, but I do know that Dr. Cantor is teaching her techniques. And so if they've been trained by her, then maybe it's okay. You also want to ask them if they use ozone. Do you use ozone in your office? How are you using ozone? We make ozone water and we put it in our water bottles. We use ozone when we do fillings. We use ozone when we're doing cleanings. We use ozone when we do surgery. We are using ozone on almost every patient. And so you want to ask them to use ozone, and how do you guys use that in your office? You want to hear that they're using it for everything pretty much. If they're like, oh, we have some ozone oil on the shelf and you can buy it, then probably not fully incorporating ozone into all of their protocols. The other thing that you want to ask if you have missing teeth or you're interested in implants is, what kind of implants do you place? There are 2 kinds of implants. There are titanium implants and there are zirconia implants, which are metal. They're white. They're metal free. They're basically a ceramic implant. A biological dentist is really only going to be placing ceramic implants. They're more biocompatible and the whole biological world is using them. So that if they say we're using titanium implants, that could be a sign that they're not really fully incorporating all of those biological methods into practice. You also want to ask them about if they use metal in their dentistry. So do you use metal in your crowns? If you have to replace a crown, are you using metal? A lot of dentists will say that they don't use metal, that they're giving you a white crown, but they're talking about what's called a PFM, which is a porcelain fused to metal crown. A porcelain fused to metal crown, the entire underside is all metal. So it is a metal crown, but dentists, I think, feel like the thing that people are the most worried about with metal is cosmetics. So they'll be like, oh, no, it doesn't have metal. It's not a gold crown. Right? It doesn't look like metal. But then the patient will come to my office and then it's all of these crowns are metal. So you want to make sure that when you're asking about crowns, they're using all porcelain, no PFM, only porcelain crowns. Okay. And of course, you don't want them to be placing mercury either, which no biological dentist should be doing, or any dentist really. So that's a good thing to ask. When we take teeth out, we also want to make sure that the dentists are using what's called PRF, which is platelet-rich fibrin. This is actually where you get your blood drawn, and they spin in the office, you get your blood drawn and they spin it down. And what they do is they take the white blood cells and all of the immune cells, basically, plus there's even some stem cells in there. That's your own body. And they use that when, like, in the hole where they took the tooth out. And what that does is it promotes better healing. And a lot of the times we can avoid even bone grafting or even dry socket when we use PRF. And so again, this is not something that you're really, maybe I might be teaching it now in dental school, but this is not something I learned in dental school to do. I had to go to advanced training to learn how to do this. 100% of the time, whether you're having wisdom teeth out or whatever, any oral surgeon, anybody should be using PRF. Okay. Like, just always. Then they get some bonus points if they're also using a laser and ozone. We want to make sure they're removing all of the infections. So if you have a tooth that's infected, you know that you need your tooth out. Ask them about, how do you do tooth extractions? Are you removing all of the infection? What kind of tools do you use to do that? The front office should be able to answer these. Okay. The other thing that a biological office does is we talk about nutrition and we talk about remineralization. So we're going to be talking to you about your diet and your lifestyle, and we're going to give you recommendations and resources so that you can really focus on your nutrition, because the nutrition and the gut health and all of that really is where all of this disease process starts. And so if we're not taking the time to talk to you about your nutrition and laying that foundation, then the other things that we do are not necessarily going to fix the problem, right? So in our office, we're very focused on treating root cause. And so when we look at somebody that has a cavity or we look at somebody that has periodontal disease, we're always asking, well, why do they have this? Why do they have a cavity? What happened? What's going on in the body? And a lot of that why comes back to nutrition. And your biological dentist should be able to have the talk with you about nutrition, and the team should be aware of it, and they should have support and resources for you. They also should be able to talk to you about remineralizing teeth. We have a couple of different remineralizing products that we use that help rebuild the enamel. We have different varnishes like nanohydroxyapatite varnish, different products that we recommend, and then different dietary recommendations too to help remineralize the teeth. So that's another thing you can ask them. And then also airway. So airway is a hot topic right now. Most biological dentists are not airway dentists. And so if you have an airway issue like sleep apnea or snoring, maybe that dentist is a little bit trained in that. But most biological dentists, it's not really part of the training that they go through, but they should be screening for airway. Okay. So if they are taking that CT scan, they're going to see the airway. They should be having a conversation with you about your airway when you go on for your new patient appointment. So you could ask them as another question, do you screen for any airway issues in your office? And if they are like, yeah, we can, and not really sure, then that probably means that they're not. So you just want to make sure that you're getting that full comprehensive care, and so much of what we see in the teeth and in our dental exam, so much of that can be a sign there's a potential airway issue. So you could ask them, do you guys offer sleep tests? What if I have an airway issue? Like, how can you help me with that? And then the last thing is, because a biological dentist is focusing so much on oral and systemic health and the connections together, it's really important that there can be communication between your GP or your naturopath or your functional medicine doctor and the dentist and the dental office. So I spend a lot of my time writing notes to practitioners or calling other doctors, coordinating care, a lot of the behind the scenes steps that I do for patients. But a lot of times we'll be like, okay, we need surgery, you have infection, but we need your vitamin D levels checked. So let's connect with your doctor and let's get that. And then, they're low. Okay, well, why are they low? Let's talk to your doctor. So I really like to be the guide for patients and help them. I want to be an advocate for my patients. And so you can expect from your biological dentist to be some of that. They should be open to connecting with your doctor if you're a really complex patient and you need that extra support. I know all of that was a lot. That's such a long list, but I think depending on what your needs are, you can pick some of those questions out. Like if you have mercury fillings and you're interested in getting them replaced, and ask them about the mercury questions. And I would also ask them about their new patient questions with the CT scan. But hopefully that list is comprehensive enough. And like I said, the front office people, if that office is trained well, the front office should be able to answer all of those questions.
Is there anything that you would say is a big time red flag?
Big time red flag would be, to me, if you're not taking a CT scan, that's a huge red flag. You just can't see. You can't see stuff. I mean, I even take my CT scans and send them to a radiologist because I want that thoroughness. I want a second pair of eyes on my CT scan. I would say CT scan is huge. If they don't have any way to evaluate the microbiome, I wouldn't go there. If they're not practicing safe mercury protocol, and if the dentist hasn't been through some kind of accreditation program and is actually accredited with the IOMT, I 100% would not go there. I think it takes a while to build a biological practice, right? Like when you start, I'm a mentor for biological dentists that are getting started. And what I usually tell them is pick a few procedures, a few things to implement on day one. And then every quarter or so, add in something else, right? You cannot build a true biological dental office in a month or two. There are so many things that go into it. There's so much training that the team needs to do. You could ask, how long have you been practicing biological dentistry? What kind of accreditations, what kind of programs? I've been through, I'm a graduate of the ACIMD, which is a naturopath program that's for dentists. So I went through a whole program. It took almost 2 years, I think, but I was flying to New Jersey every other month and basically learning naturopathic medicine and doing all this homework and side stuff. And so I went through that program. And then I spent some time at the Institute for Functional Medicine with all these MDs, and I did a whole thing there. And I've gone to ozone classes and laser classes, and there's just so much, right? Like you can't expect these dentists to all be if you're starting out, then you got to take it one step at a time. But again, it goes back to what you're looking for in a dentist, right? If you're just looking for mercury removal, if you find somebody who's accredited and maybe they don't place metal-free implants. I don't place implants. Dr. Isabel does. We do it here, but I don't do it. So we have the option, but every dentist is going to be in a different place in their journey. And if you don't need implants and they're doing metal on still or they're not doing it at all, then fine. As long as they've fully implemented the thing that you're looking for, I think that's really ideal. And I guess I just hear it every day. I went to all these other dentists that claimed to be holistic and biological, and I expected what I had here to be what they were saying. Like they find our office and they're like, wow, like this is so different than any other biological office. And I know that there are some excellent biological dentists because I know that they've been through the programs with me. I got a lot of great friends that are doing it right, who are screening, who have all of these things. So they're out there. But I think that patients don't know the questions to ask. And if you go to a website and, biological dentistry, you're like, that's what it said. But if you're truly looking for a comprehensive biological dentist, you've got to be a little bit more of an advocate for yourself, and you've got to start asking these questions.
I love it. No, this is a great list, comprehensive list, just like how we do everything at Green City, very comprehensive. And another tip I would probably throw out there is that if you ask about how long you would expect their initial intake exam to be, I think that's another clue. We sometimes hear about those initial exams being relatively short, and that would also be a red flag in my mind.
Yeah, for sure. I think, yeah, absolutely. We definitely take more time with patients, and we focus a lot on patient education. So if you feel like you're going to the dentist and get in, get out, and you have no time, there's no teaching time, there's no resources, there's, it's like brush and floss more and that's it. Like, you're not in a biological office, because the biological dentist is going to slow down. They're going to take the time to really dive deep with you into what is going on. Why is this happening? All comes back to the why. And to do that, you have to have proper diagnostics and you have to slow down.
Slow down to go fast sometimes is the way to go. Well, thank you so much, Dr. T. This was an awesome resource for everybody out there looking to find that perfect dentist who's really willing and able to go deep, get to the root cause, and help you and your family have the type of just holistic, systemic, whole body health that a biological dentist can bring to the table. It's absolutely incredible, because it's not something that any other medical professional is looking at. So finding the right, true, legit biological dentist, like how you practice it, is a complete health game changer. And it's something that we recommend it. Everybody, get yourself a really comprehensive dentist who goes deep and asks those questions and does those kinds of tests. Until next time, your mouth matters.